This is Average Joe PT. On this episode, Scully and I, we're going to talk about headaches, where they're coming from, what you can do about it, and hopefully by the end of this episode, your headaches will be gone. So stay tuned. So let's go ahead and talk about those headaches. Where are they coming from? Are they coming from high blood pressure? Are they coming from those muscles across the base of the skull? And that's what I want to talk about right now, is a lot of times those muscles across the base of that skull that attach to the first bone, they're going to radiate pain up into your head, into your eyes. They can radiate pain down your neck. Those muscles are called your suboccipital muscles, or what we call your nodding muscles. And when you fall, when you sleep wrong, when you get into a car crash, almost anything, looking down at your phone for long periods of time or the computer will start to get those specific muscles in that area inflamed and irritated, and they'll start to give you headaches. Crazy enough, those tiny little muscles really can cause a big problem. And next thing you know, you're having headaches for days and you don't know why. So I want you guys to stick around. I got a few more things to talk about when it comes to headaches and how to get rid of them. So stay tuned. Let's just zoom in for a second and really dissect why probably 90% of you are having headaches in the first place. Once you get this down pat, you can eliminate having headaches most of the time. Now, one thing you might want to do is just try some medicine, some Aleve, any type of anti-inflammatory, Excedrin. Now that Excedrin medicine has caffeine in it, and when you combine that anti-inflammatory and that caffeine together, it becomes TNT. It really helps to accelerate reducing that pain and the tension in your head. So that's one huge benefit. Now I want you guys to look now at this model here. I'm just zooming really close to you now, so don't get nervous. And like I said before, those two muscle groups in this area here, those three muscle groups, and you go ahead and you put a lot of tension on that by having your head look down for long periods of time, because it's going from here to here, that's going to give you that headache that we talked about. Now, when we want to reduce that pain, and we want to do it immediately, besides medication, non-pharmaceutical, you might want to literally just put some ice at the base of that skull, lying down on your back for maybe 15-20 minutes, and you'll see how much relief you get from that. And another reason why you might be having a headache, especially maybe in the afternoon, is just that stress, that tension, what we call those trigger points in those muscles in your upper neck area can get inflamed and start giving you some headache up along what we call the upper trapezius muscle groups and the levator scapula muscle groups. Now I'm going to go ahead and leave a tag up here, a card for you guys to look at. I go over all the different types of reasons why you might be having muscle-based headaches versus just the ones that I'm talking about today, specifically that levator scapula, and some treatment techniques like massage, Theracane, a tennis ball, taping techniques that you can go over and do in your own home to reduce that pain in your head. But with this episode, we want to zoom in just a little bit closer now, and we think about this joint where my finger's at on either side, and those also can give you headaches. Now those are your facet joints, and we come up here in this little baby one, and if you're doing a lot of flexing like that, you can, when looking downwards, you can see where those joints, as well as the muscle tissue, but specifically the joint, can get inflamed too. And next thing you know, you're having headaches because of that joint. You feel like you can't move your head. You hear a lot of crispy crackety going on in your neck. That's coming from a combination of those joints as well as that soft tissue, because that soft tissue gets inflamed and really can't stretch out and release again once it gets tension in there. Now I want you guys to stick around just one more second for me, okay? And we're gonna go over one more thing, so I want you to stay tuned. Now, the last thing I want to talk about on this episode is if you're having a hard problem moving your neck one way or the other way, or up or down, one big thing you can do to try and help reduce that is just take your fingertips and just kind of come around the back side of that joint and just work it side to side. You might even hear a little bit of crunching going on. Just gently working that back and forth, side to side. And really what you're doing is you're taking those muscles that run on either side of the spine here and just getting in there and getting some blood flow back in that area to try and get those muscles to relax. Now that's a huge thing I do all the time, especially when you're just have a lot of tension or you're looking strong and specifically at one spot for a long period of time, really focusing. So, that is this episode, and Scully and I would love to have you guys become subscribers and hit the bell, all right? And if not, hopefully my content gives you a little bit of information. And Scully and I like to say, until next time, look up and keep smiling. See you next time.